Hi everyone, welcome back to Pathway. I know it has been a long break for me because I had my marriage and then settling to a new place, a new job. So it took me time to come back to the presentations. Anyways, I have come back and I thought I'll start with the basics because DNB exam is approaching practical. So I thought I will give a glimpse about how to approach slide reporting. Exam edition, like, because I feel the approach in exam is different. Okay, the approach basically to a slide is same itself, but how to do it within the time constraints. So I'm just going to concentrate about how to approach only, especially during exams. You can put it in daily life also as you like, but I'll be stressing on the points especially useful for exam. Okay, so we'll be discussing about the five main slides that will be coming for exam, that is histopathology, cytology, pap smear, hematology and bone marrow. So time limit. Okay, that is the main thing, the main catch. Within 5 minutes, how are you going to diagnose a case and write the description as well? So it's very important that you have a format, especially in points, I would say, because I feel it is easier to write it in points and have the format as such feed it onto your cerebral cortex. So, and then the third thing is practice. See, you have to see as much as slides as possible and you have to practice the format, okay, which I'm telling to you, the approach to the slide as much as possible so that it would be easier at the time of exams, that you don't have to put so much of brain onto how to write and all. Okay, so slides also, I would say in Maharashtra we have mapcon slide boxes, or in your college also if you have good slide boxes of basic things and good cases you can see that. But I would say don't go and see all those hi-fi cases with very difficult diagnosis which your HOD or only 2 3 professors sat and made. Okay, see, such things are not going to come for exam. Maybe some very difficult, I would say, examiners can try to make see how is your approach, can keep 1 or 2 difficult slides, but I would say don't put your exam entirely based on those two difficult slides. See, most of the slides that are going to come as basic or like medium level of difficulty to see how your approach is to the slides. So just stick on to the slides which you feel are medium difficult or easier to diagnose. Okay, and then you have to study books, of course. So practical exam, obviously you have to see slides and see the gross specimens and all those things matters, but then you have to study also. So I would say the Tejinder Singh DNB MD practical book is there, which most of the people might be knowing. So that is very helpful. So that is what I had been studying all through my practical exams. Especially there are so many photos in that, and then there are descriptions or question and answers which are below that. I basically, if you don't have much time, you don't have to concentrate on those questions and all, because during the slide exam you don't have to focus on those questions and answers. Okay, so they are basically telling about how to approach a slide, so you just have to look on to the, especially those photos, and you just can see the history and just close the diagnosis and see whether you can come to a diagnosis seeing that picture. Okay, it's not a picture diagnosis, pathology is, I know, but then for an exam you have to sort easy ways sometimes, so just register those pictures on mind, especially to clear exams. And then Sandhya Sundaram also, it's also a really good book, like Tejinder Singh. Many of my friends also have studied that, especially during exams. So which one is possible for you and you feel easier, you can take that. And then Sternberg. Okay, now you people will be thinking, okay, ma'am, Sternberg is such a book. How can I see that for study that for this practical exam in a short period of time? See, I'm telling only people who have time. You can look at through the pictures of Sternberg. Okay, see, pictures of Sternberg are really good, and like I feel even practically, if you have some difficult cases, for some picture matchings and all, you can try Sternberg. Especially, okay, no, pathology is not picture matching, but then for exam especially it can be sought to. So some areas which you feel it is difficult, like some GIT or skin or something like that, some topics which you feel is difficult for you, you can go through the pictures in Sternberg. It will be really helpful. And then combine study as much as possible. This may you must have been knowing since childhood, because whenever practical exam come, theory also is useful, especially in practical it's very useful, because when friends say and we make mistakes, it's easier that you discuss and things get registered more fast into your brain. So coming to the main thing, so histopathology slides. Okay, so my format of approach was like, first you have to identify which is the stain used. Okay, obviously in histopathology mostly it will be HNE slides, and rarely you can get IHC slides. Okay, I don't know whether it is present in some centers or something, but mostly they will keep only HNE slides. Okay, just for the format sake you have to remember that, because for other slides also you have to remember this stain used. So you will be using HNE mostly for histopathology, and then you have to identify the organ or the site from which the cut has been taken. Okay, sometimes you will get it from the history, or else first when you look at the slide itself, first try to identify which is the site or the organ you're looking at. Okay, and then come to the architecture, how it is, whether the normal architecture is preserved, especially like if it is a lymph node, if you have identified whether there are follicles etc, or it is partially or totally effaced. Like see, if it is a TB case, then you can see that most of the follicles might be partially or totally replaced by granulomas etc. So you can write about that. And then next you will write about the pattern. Okay, see, pattern is also very important. You have to see whether the lesion is circumscribed or encapsulated, especially when it is a tumor, and if it is solid or cystic lesion, or whether the lesion is diffuse or focal. And then come to the next pattern, that is inside of the lesion, which whether it is papillary, glandular, sheet like, or in nests. And then you come to the individual cell morphology. You see that I'm coming from out to in, you're describing about the normal organ or something, and whether where it is replaced, and in that place you focus whether it is solid, cystic, and come inside whether it is papillary, glandular, and then come inside that whether the individual cell morphology. Okay, in that also I would say go from out to in. Look at the cell membrane, whether it is prominent or not, then come to the cytoplasm, whether it is clear, granular, etc., and how it is abundant or scant or moderate, and then come to the nuclear membrane, whether it is irregular or whether it is regular, well defined, and then whether it is prominent, and then look at the chromatin, whether it is vesicular or hyperchromatic, and come to the nucleoli, whether it is prominent or inconspicuous. And then you will come to the other things which are especially important in tumor cases, whether there is necrosis, whether there is hemorrhage, and tell about the mitosis. And then you tell whether there is presence of granuloma or not. Okay, and then you have to write a differential diagnosis. Okay, I will stress mostly you have to put onto differential diagnosis than stick onto one specific diagnosis, because it's very like until you're too confident you might be getting the right diagnosis if you're writing, but in case there is a chance of error, differential diagnosis would be very helpful for you. Like in 3 or 4 diagnoses which you wrote, if one is the right answer, still you get points. So the points to remember is format. Okay, so okay, before telling about format, I had to say that see, slides are the most important station in your exam. See what, that's what my HOD has said to me. See, if you don't do well in slides, rest of the stations won't count at all. And if you do slides well, other stations might well be covered up by your examiners. They will make you pass still. Okay, so it's important to practice the slides especially, and you have to have an approach of slide. Okay, see, when you get a slide while studying itself, you try to put that approach into your practice. Okay, in 5 minutes of one slide, you have to take less than 1 minute to glance through the slide and see whether you can get a diagnosis or not. Okay, and if you are definite that see it's not getting into like minors, ki what the diagnosis is, then just start to write in the format. Just write the description, start to write the description, and don't waste your time. And then it might be helpful to come to the diagnosis or differential diagnosis. See, the more time you waste in thinking what it be, the less time you will be getting to write the description. So just take 1 minute or maximum to figure out what it is, and if you're not getting, just start it in the format itself, writing. So whatever is possible for you, because that will save time and will give you more marks. Okay. So format and points. I'll tell you it is better to write in points because so the examiner also gets a good impression about you and knows that you have a format that you don't miss out anything. I had written all my exams everything in points itself. See, because usually we write the descriptions in sentence, but it's very difficult to form a sentence and put it grammatically correct, especially during your exam. It's so much of a brain work. You don't have to put that much effort into it. Just write it in points and see. I said, if you have a format already in your mind of approaching each slides, then you just start it in the points. It will be easier to tackle the exam. Okay, and when you're practicing itself, try to put those format and then practice the slides. And then coming to differential diagnosis, try to give little broad differential diagnosis, especially if you are not sure. Okay, like see what type of carcinoma or sarcoma. I have given very broad diagnosis also, like benign tumor or like malignant tumor or something, like especially tumor itself is also a diagnosis, because uh, saying whether it is a non-malignant lesion or malignant lesion is also a question. Try to come to a diagnosis, but put always a differential diagnosis, because it's like sometimes very less chance that you get that exact diagnosis which you are clinched onto, because there are so many lesions that look alike. So if you're really confident, you can write diagnosis, but still I would say after your diagnosis, write 2 to 3 differential diagnosis in case you get wrong. Okay, because there was 1 or 2 questions for me which I had written only one diagnosis, and which things which I had thought it might be was actually the thing. And then during my DNB exam, I just put that thing into my consideration. I never wrote one diagnosis in any of my slides. I wrote at least 2 to 3 DDs, and that was very helpful for me. And then exclude TB always. Okay, see, TB is very prevalent in India, especially. So you have to always exclude whether there is a granuloma, because see, if you miss a granuloma, it's like a very grave mistake, especially during exams. It's like, why are you a pathologist if you can't even identify a granuloma? Okay, at times during the exam fear you don't remember, but while practicing itself, try to see whether it's not a case of TB. Okay, and then if you are not getting a diagnosis, start searching for parasite and fungus. Keep this in mind, okay? Because they are especially important slides during exam. They will put parasite or fungus, obviously. So if you're not getting into any histopathology or cytology, especially if you're not getting into a diagnosis, start searching for parasites and funguses, okay? And there can be some cases in which the morphology is really undifferentiated. You can't put it into any diagnosis, which you can write it as undifferentiated carcinoma or undifferentiated sarcoma, and obviously keep melanoma also in your DD. This is what my examiner had said when there was a case like this, okay? Because they are not going to think like going to like see whether you know the exact diagnosis or not. They just want to see how your approach is towards the slide. So they want you to keep melanoma obviously in your differential, especially when such difficult and differentiated cases come. Okay, so keep that in mind. And then I would say don't wait for any help. Okay. See, there has been, I'm not telling it is illegal, you shouldn't do help or something like that, but then See, especially when you waiting for the help you might get might be too late, or it can even mislead you. So just keep up with the time, do your work, write your description, and keep. And if you are really, really in required, so you don't have any idea you want to ask, it's up to you. But then I would say just stick on to your plan, because if it is going in a wrong way, you will start regretting about yourself. Why did I even waste my time? Like, kind of, okay. And then I would say don't leave any slide blank. Please write some description so that the examiner will give you a chance to rectify your diagnosis, because they know that the description was good, what your approach was good. So if the diagnosis was wrong, they would give you a chance to think like what all are the things that can come in that area with this description. Okay, or else if you are not writing that also, they would just give you 0 marks for that slide, and they would even not give you a chance to rectify. Okay, so try to get maximum marks, so don't leave the chance. Okay, and then coming to cytology. So cytology, in that first you have to see which is the slide given, whether it is an aspirated fluid or if it is an FNAC. Okay, and then you check which is the stain used, especially for cytology. You have to see whether it is HNE, PAP, GIMSA, AFV, etc. Okay, and then you have to see where is the site or the organ from where it was aspirated, and then you have to comment upon the cellularity, whether it is hypocellular, paucicellular, acellular. Okay, that is very less chance. And then high cellularity, and then highly cellular cases, etc. So then next after that you will come on to cell arrangement. Okay, that you know whether it is in sheets, whether it is separated from each other, what they are in clusters, nests, glandular arrangement, etc. The arrangement pattern, you know. And then you come to the individual cell morphology, where the same thing which I had repeated in the histopathology describe the cell. And then one important thing in cytology is the background, whether it is hemorrhagic, necrotic, clear background, or you see any fluidic background or anything, whatever you see you can write. And then you have to write your differential diagnosis. So this is the approach in a cytology case. Okay, and then coming to pap smear. Okay, pap smear, you can get it a conventional pap which is used in most of the medical colleges, and then you can get even a liquid based preparation in good centers. Okay, so you have that, you know, to identify, I guess, see conventional pap how it looks, and then liquid based preparation how it looks. So study the differences and all, and keep. And then you have to say whether how much it is adequate. So the adequacy criteria you have to know in conventional and liquid based preparation. And then you will tell about the cells you're seeing, the squamous cells, whether there is a superficial, intermediate, parabasal, basal, and then the glandular, whether you're seeing the transitional cells or whether you're seeing squamous metaplastic cells. Comment upon that normally. And you should know that in the latest Bethesda, that is not important like in the adequacy criteria, that transitional cells is required. Before it was there. Okay, and then abnormal cells, you have to obviously comment upon whether there is colocytic cells, dysplastic cells, and malignant, whether it is malignant squamous or malignant glandular cells. And then you have to comment upon the background, whether you're seeing lactobacillus, that is the normal vaginal flora, or whether it is altered, like you are seeing trichomonas vaginalis, or you are seeing candida, etc. That is coming under parasite also. And then whether there is any hemorrhagic or necrotic background, especially in malignancy, you can write that also. And if it is LBC, usually you will get a clear background also. And then impression, you should know the criteria of Bethesda to write whether it is negative for intra epithelial lesion or malignancy, or you put it under LCIL, HCIL, or especially atrophic smear also, you should know how it looks like. Okay, so because that also, so, and I would say in pap also you can put DD. Okay, say because the case which I got in exam was HCIL or atrophic smear kind of. Okay, so the examiner was like, if you had been confused between either of the two, I would have given you marks. Okay, and I had thought it was a trophic smear almost. But then I wrote atrophic itself, but then they were like, see, if you had written Excel also, it was fine because see, your approach was right to think. And then we'll come to the hematology next. So, hemat slides, how do you approach? So, first you have to write the stain used, okay, and then you will write about the RPC morphology and that whether there is normocytic, normoblastic, or microcytic, or whether there is any sickle cell or any abnormal cells, bite cells, etc. Whatever you see, target cells and the schistocytes, etc. Whatever you see, you have to write, and then tell about the WBC, how the count is increased, decreased, or whether the differential, if you are saying increased lymphocytes or blasts or neutrophilic population, etc., and if there is any atypical cell, tell about that, especially the blast, etc. And then you tell about the platelets, whether it is increased, decreased, or giant platelets are there or not, and then you comment upon the parasite, which is the most of the hematology slides you get, 12 malaria or filaria, etc. And one thing also, you can stick on to the background also, you can see, okay, see, there was a multiple myeloma case for me in exam and the background was bluish, okay. See, but then still I was like, see, I didn't put the format accordingly in this, there is no background, but then see, there was rouleau formation in the RBC morphology, and that should click to you that this can be a case of multiple myeloma. Then when you're coming to the WBC, there was plasma cells, obviously, when I had searched, and then that should click to you that the diagnosis can be multiple myeloma. And then obviously you have to write differential diagnosis. You can't write straight away multiple myeloma because there is a criteria for that. This is not just a slide. So you can write that plasma cell dyscrasia or something. That is a broad diagnosis, okay, you have to write. And then especially you people know, I guess, ki acute leukemia, you have to write acute leukemia and obviously advice. About that advice you can write in the slides, okay. So it gives a good impression about you, especially if it is leukemia or HPLC for any hemoglobinopathies, etc. You can try that too, because see, differential diagnosis for no or diagnosis only also for hemat cases, especially you can write acute leukemia, okay, and then you will advise for flow cytometry, etc., because you are not supposed to give acute myeloid leukemia, acute lymphoblastic or leukemia, etc., especially during slides, because that is what our teachers also have said, especially in practice also you give like that only, mainly because the morphology is very deceptive, okay. So don't go for definitive diagnosis like acute leukemia, acute lymphoblastic, or acute myeloid leukemia, etc. If they have given a special stain with you, then you can go for try to give that, whether it is promyelocytic or myeloid, etc. See, that depends on you, but then there you can try for a definite diagnosis, but then otherwise I would tell to you in practice also try to give broad diagnosis, whether it is acute or chronic leukemia, that much only, and then give for flow cytometry. And if you want, you discuss with the clinician, but then don't give right, because your diagnosis is always on paper, okay. And if you gave AML and in flow cytometry it turned out to be ALL, see, clinician had thought about that, okay, but it is not written anywhere that the clinician had thought. See, we had also thought, but at least if we had put it as acute leukemia, we are not wrong in paper. See, our things go in paper, so it's obviously good to stick on to your differential diagnosis or to your broad diagnosis or everything. So always while reporting your slide, especially in practice, also think that, see, you can go wrong, so obviously stick on to a broader thing, and whatever specific thing you want, you just tell to the clinician, okay, or write it in your advice that rule out this thing or that thing, the features are suggestive of this thing, so try to rule out that thing, like that, okay, than sticking on to a very definitive diagnosis. And if things turn out different, then obviously the patient or patient's relative can catch on to you, because it's on paper that you had given this diagnosis and from other sender it has been given other diagnosis, so how can you justify that, okay, like that many cases have happened. So that is just a practical point, okay. I had went far away from the topic, so let's just get back. So bone marrow. So in bone marrow, I would say first you had to write about the stain used, okay, Mostly it will be HNE, and then you have to write about the cellularity. So sorry, HNE is especially for bone marrow biopsy, and here I have given mainly the format of aspirate because see, bone marrow aspirate is the main thing which they will be keeping on for exam. I'm not telling that biopsy won't be kept. See, biopsy also will be kept, but the those cases it will be very obvious diagnosis. Okay, so it will be maybe TB or metastasis or gelatinous transformation or marrow fibrosis, because in that case at right up you will get an aspirate. So it will be very obvious case if it is a biopsy. Okay, so aspirate, how you're going to approach, you will write about the stain used, it will, then you have to write about the cellularity, and then you have to write about the ME ratio, and then you comment about the erythroid series. Okay, one thing, cellularity, you people know, right? Hypocellular, hyper, high cellularity, hypercellularity, how do you say according to the age, like 1 to 100, the 100 rule. That is, if the person is 30 years old, then you need 70 percentage cellularity, and if it is 70 years old, 70, then you need 30 percentage cellularity. So that you have to keep in mind. And then telling about the erythroid series, you have to tell whether it is normoblastic, megaloblastic, etc., and whether the count is increased, decreased. Myeloid series, whether the blasts are increased, decreased, and which kind of series you are seeing, lymphoid or lymphoid or eosinophilic or whatever series you have seen in increased population, you have to write about that. Even if you're seeing plasma cells increased, you have to write about that. And then megakaryoblast series you are seeing, you have to write about that, whether they are normal, increased number, decreased number, etc. And comment upon the others also, whether you are seeing any metastasis or any granuloma, whether there is any gelatinous transformation, whether you are seeing any marrow fibrosis, necrosis, or if there is any parasite also. See, these things are I had included in this slide especially for the bone marrow biopsy. Okay, these are the things you have to keep in mind. In aspirate, it's not of much importance of this fibrosis and all, but see, obviously you in biopsy you can see to another diagnosis is storage diseases like Gaucher, etc. Okay, see, that also can be kept because in that you will see those characteristic cells. Okay, so that thing also you have to keep in mind, and then you have to comment upon the differential diagnosis. Okay, after see writing all those things. So these are the things of format. So I think this will be very helpful, especially for approaching a slide. And I would say try to, while seeing the slides itself, to write things in this format, or just repeat these format in yourself, because if you practice more you can put into your exam very easily. Okay, and then summarizing, see, write some diagnosis after description always. Okay, why? Because see, if you're not leaving the diagnosis part blank, it is still fine. You had an approach, you wrote the diagnosis at least. But I would prefer you write a DD and keep something at least. So if you don't have time, also see, write description, but even if you leave diagnosis, it's still fine. Okay, but you don't write diagnosis only without any description, then they will catch you for unfair means, obviously, because that has happened to my friends also. Okay, they are like, hi, at the last minute you got the answer from somewhere else, so don't do that. Okay, write some description even if you get answer from somewhere. So then the rest of the things what you have to study, you have to study about the stain procedures, how to stain the slide. Obviously HNE you have to know, you can go to the lab and ask your technician to teach, and then you have to know about the other special stain procedures. Also you can ask the seniors and they will give you some photo clips or some book writings where you can understand, or you can just go and ask your technician, write down the procedure, like how is the pap stain done, or special stains also done, like mason trichrome, pass stain, etc. So that also you have to know for exam. And then chat and discussions and all, you have to try to discuss with your friends and study maximum. And especially if it is MD exam thesis, you have to just make a summary by yourself while studying it, stuff like aims, objectives, results, etc., and rehearse by yourself 2 3 times beforehand and keep. And that would be very useful. And then I would say, see, confidence, that is which matters really. Okay, uh, it's not much important to write the whole thing you see as findings in your paper. Okay, you are just wasting your time. Whatever gross you see and whatever you did not see, you don't have to write that much. Okay, see, they give you papers to write, and that is just to write some headings or points, uh, and the diagnosis what you have in your mind. Okay, so that it will help you to remember things easily when you're going and sitting for viva. You don't have to write the whole thing and waste your time. Okay, and try to rehearse what you have written or what you're going to tell to the examiner, like your specimen of organ measuring so and so and so, and externally the serosal surface shows this thing and the mucosal surface shows this thing and all. And then since these are the relevant findings, etc., my first DD is this one and the second DD is this one, etc. So try to have a format for everything also. Okay, so for gross specimens, autopsy specimens, everything. And then try to study Tata manual of grossing, especially for the important specimens, gross specimens that can be kept, especially. And you have to know what are the number of lymph nodes required for writing the description and for the diagnosis, etc. For the grossing, how much lymph nodes minimum you have to be uh, taking out, and then the important margins of the specimen, etc., you have to know. So rehearse each specimen and charts as much as possible before you're getting inside the room or the exam hall. That is how you increase your confidence. Okay, and even if you don't know, say whatever you know confidently. Okay, that is the main thing. You're telling a blunder confidently. Okay, I know, but that gives a very different impression that you are confident on your thing and your knowledge. Okay, but at the same time, you should be also polite, patient, and humble, and don't be arrogant. So, and be ready to listen to whatever the examiner is saying and agree if there is any mistakes, your mistakes, and then whatever he says, just do according to that, because it's important to you to pass the exam. Okay, so stay humble. Okay, and then tell everything in a slow pace confidently. Okay, it will give you time to think and to analyze whatever you're telling than simply blabbering so much in fast mode. You won't be understanding what you're telling or what is coming out of your mouth, and then that would give a very bad impression to the examiner. So, and other thing is that when you tell things confidently in a slow pace, there is a time limit which will be covered also. Okay, that is like 5 minutes or 10 minutes, which is set on for your viva. And if you tell it is in a slow confident way, the time is also going, and whatever you are telling will be a good answer. Okay, so you have to cover the time limit also. That is also one of your aims, and you should be speaking something within that time period, so that, and don't try to shut your mouth unless you have been asked something which you really can't even guess. Okay, try to answer something always. Okay, that you are trying, at least you have to show. And then combine study as much as possible, I would say, because discussing the slides will register onto you so much easily, and it would be very helpful for your exam. Okay, so try to see maximum number of slides and try to put on the format and points and practice like that, and that would be very helpful for your exam. So all the best for all the people and my dear students who are appearing for the exam. Thank you.